So if you're watching this video, it's probably because you don't know whether or not your child has dyslexia, and I'm going to show you some things to look out for. This is not in place of getting professional advice locally, but this is a step towards understanding what might be going on. Now, usually when a parent is fearing that their child has dyslexia, it comes down to one of three scenarios. The first scenario is that their child will have a form of visual dyslexia called scotopic sensitivity, also known as Erlen syndrome among some people. Basically, the words on the page are moving and that makes it hard for your child to read. Now, the good news is that this is fairly straightforward to help. So if that's what your child's dealing with, you're in a good spot to begin with. Now, the second scenario that you could be dealing with is your child may have phonological dyslexia. This is classic dyslexia where the words are not moving on the page. They're not moving on the page at all, but what's happening is somewhere in your child's brain, they're struggling to be able to make the words do their job deep down. So for phonological or auditory dyslexia, what's really going on is between the written words on the page, up to your child's head, and then back out onto the page that your child's writing, then there's all these just difficulty in getting that text in there and then back out. It's tricky and it's a lifelong thing, and there's plenty that you can do about it, but what you don't want to do is keep persevering with things that aren't going to work, because that's just going to discourage your child. And then the third scenario, which I hope is the case for you and your child, is that your child does not have dyslexia at all. Okay, the words are not moving on the page, so it's not just a visual scotopic syndrome sort of dyslexia. The child is actually completely capable of learning and regularly using all these different skills that your child just hasn't learnt yet. So for scenario 3, being your child does not have dyslexia, then you want to look at things like, has your child needed glasses for a long time? Have they just needed a hearing test for a long time, especially if they're young? And a few other things that you can read about. Now, the key things to look for to determine if your child has a form of visual dyslexia called scotopic sensitivity, also called by some people Erlen syndrome, is, are the words moving on the page? Easy to check that out. You just get a piece of bright white paper, very white, and you just make sure it's full of text. You have the child stare at a point in the middle of the page, and then you just let that child stare at that text for 10, 15 seconds, and then ask the child, what is the text doing? If the child says the words are moving, the lines are moving, the words are jumbling around, the words are fading away or shaking, anything except the words are staying still. What's wrong with you, Mum, for asking me such a dumb question? Anything other than the words are staying still means that that's possibly what your child is dealing with. Now, what the experts look for when they are trying to diagnose your child for phonological dyslexia or auditory dyslexia is that they're looking for three things. They're looking for, first of all, is there definitely a reading problem? Is there a bit of a gap between your child's skills and the other kids in the class? That's number one. Number two, they're looking for some sort of unexpectedness or some sort of surprise about, oh, hold on, why is your child struggling? It's not because they've got a brain injury. It's not because of, they've had 3 years with the worst teacher in the district. There doesn't seem to be a reason why they're struggling so much, because they seem bright in other areas. There's nothing that should be holding them back. And the third thing that the experts will be looking for to diagnose your child with auditory dyslexia or phonological dyslexia is, does your child understand how to pull words apart and then put them back together? If they're struggling to put words back together, or say the word plain, as in P-L-A-I-N, if they can't tell you very quickly that plain without the L would be the word pain, then that's the sort of thing that they're looking for that makes them go, oh, looks like it's phonological dyslexia. Now, this is a, 3-minute video or something. This is not going to class as professional advice. This is just what the indicators are, so you can know whether or not you need to look further, investigate further, and have some professionals look at your child. I hope you take this further. I hope you get the help your child needs. I hope that your child doesn't just have to sit there while you or school or someone else waits and sees if they're magically going to catch up. The longer you leave it, the harder it is for them to catch up, so I really encourage you to act early.